Hello, I'm Mohammed Zari. I'm an instructor in internal diseases and surgery from Shahid Beheshti University of Medical Sciences, Tehran. In this video, I want to talk about the causes of incomplete bladder emptying and straining during urination. Please hit the like button and keep watching the video. Urinary retention means the inability to completely empty the bladder. While anyone can experience urinary retention, older men are significantly more prone to developing this condition. There are two primary categories of urinary retention. The first is known as acute urinary retention. Acute urinary retention occurs very suddenly and typically only lasts for a relatively short period of time. This specific type of urinary retention is so dangerous that it can even become life-threatening. This is because even though the bladder is full, the affected person is unable to urinate. The symptoms of acute urinary retention include the following: pain in the lower abdomen, discomfort, a sudden urge to urinate, and inability to empty the bladder are symptoms. The second type is chronic urinary retention, which lasts for a longer period of time. People who develop this type of urinary retention are able to urinate, but they are unable to completely empty their bladder. They don't feel relieved and sense that a few drops of urine remain in their bladder. What are the symptoms of chronic urinary retention? A feeling of pressure below the abdomen, a weak urine stream, and abdominal pain. Frequent urination, which we define as urinating 8 times or more per day. Frequent urination, difficulty completely emptying the bladder, and trouble starting the urine stream. Chronic urinary retention is a medical condition that lasts longer compared to other forms. In this form, people are able to urinate, but the bladder does not empty completely. Most people don't realize they have this condition until another problem arises, such as urinary incontinence or a urinary tract infection, caused by the growth of harmful bacteria in the entire urinary system. You might ask, why can't we completely empty our bladder? Urinary retention can result from several factors, such as neurological problems, medications, weakening of the bladder muscles, and urinary tract obstruction. Urinary tract obstruction, by blocking the normal flow of urine out of the body, can cause urinary retention. Various medical conditions include benign prostatic hyperplasia, urethral stricture, urinary tract stones, cystocele or bladder prolapse, rectocele or rectal prolapse, diverticulum, tumors, and cancerous growths. All of these can cause urinary retention. If this complication is not addressed or treated, it can cause significant physical discomfort, severe pain, and other serious medical symptoms. In cases like these, it may even become life-threatening. Therefore, if you experience the mentioned symptoms, you should seek medical treatment immediately. Timely use of medical and home treatments can effectively alleviate symptoms and improve your quality of life, especially in men aged 50 to 60. Incomplete urination is frequently caused by the gradual enlargement of the prostate as a result of benign prostatic hyperplasia, or BPH. This is a medical condition in which the prostate gland enlarges, but it is not cancerous. The prostate has two main growth phases. The first growth occurs during puberty, when the prostate doubles in size. The second growth phase begins around the age of 25 and continues throughout a person's life. Benign prostatic hyperplasia is mostly associated with this second growth phase. As the prostate enlarges, the gland puts pressure on the urinary tract and the bladder wall becomes thicker. Eventually, the bladder may become weak and lose its ability to fully empty urine, causing urine to remain in the bladder. The second factor that can lead to incomplete urination is narrowing of the urinary tract. The causes of urinary tract narrowing include inflammation after surgery, scar tissue resulting from surgery, diseases, urinary tract infections, and/or injury. This can happen in men. Causes include prostatitis, scar tissue post-penile surgery, BPH surgery, and prostate cancer. Surgeries for pelvic organ prolapse, like cystocele and rectocele, and incontinence are also factors. Urinary catheters can also cause narrowing of the urinary tract. Narrowing of the urinary tract often improves a few weeks after surgery because the male urethra is longer than the female urethra. The likelihood of developing urethral stricture is higher in men than in women. Urethral stricture and acute or chronic urinary retention may occur when the muscles around the urethra are not relaxed. This condition mostly occurs in women. The third cause of incomplete bladder emptying is the presence of stones in the urinary tract. These stones are formed from crystals present in the urine and accumulate on the inner surfaces of the kidneys, ureters, or bladder. Stones that form inside the bladder may cause obstruction of the urinary tract. The fourth cause is cystocele, which refers to the bulging of the bladder into the vagina, cystocele. This happens when the muscles and supportive tissues between the bladder and the vagina in women become weak, and this creates a stretch which causes the bladder to sag from its normal position and form a bulge toward the vagina. The abnormal position of the bladder puts pressure on the urinary tract and causes it to narrow. The next issue is rectocele, which refers to the bulging of the rectum into the vagina. Rectocele. This occurs when the muscles and supportive tissues between the rectum and the vagina in women become weak and a stretch develops there. This causes the rectum to hang down from its normal position and bulge toward the vagina. The abnormal position of the rectum puts pressure on the urinary tract and causes it to narrow, and the last issue is due to muscle weakness. Some people with this condition need to strain more they have bowel movements. Hard, impacted stool in the rectum can exert pressure on the bladder and urinary tract, leading to the narrowing of the urinary tract. This occurs especially if a rectocele is present. Tumors in cancerous tissues in the bladder or urinary tract can also gradually grow and block the flow of urine, which they do by putting pressure and narrowing on the tracts or causing an obstruction at the bladder outlet. There are herbal treatments for incomplete bladder emptying in both women and men that I want to talk about. Next, I want to introduce 5 herbal remedies to help solve this problem. The first is prostate medications for treating urinary retention. The main cause of urinary retention, especially in men, is prostate enlargement. That's why one of the most popular methods for treating urinary retention is taking prostate medications. These drugs can include things like alpha blockers. Prescribed medications include alpha blockers such as alfuzosin, doxazosin, silodosin, and tamsulosin. Additionally, 5-alpha reductase inhibitors like finasteride are often used. Taking these medications can help reduce symptoms related to urinary retention and stop the enlargement of the prostate gland, or even shrink it, but they require a doctor's prescription. Prostate medications can also relax your bladder muscles to help establish a better urinary flow. The second treatment, which I recommend, is the use of dandelion. Dandelion? It is a common type of wild flowering plant that grows naturally in open fields and meadows. Historically, Native Americans used the dandelion root to treat various kidney diseases, stomach burning, and general digestive discomfort. Dandelion has powerful anti-inflammatory properties and is widely recognized for its benefits. It is frequently utilized as a diuretic and helps treat bladder inflammation and urinary retention. The third remedy is nettle. Nettle is a plant used to treat inflammation of the urinary tract or bladder inflammation. This plant has restorative properties that help heal the bladder and kidneys. This plant is mostly used as a diuretic. For this purpose, the plant is usually consumed as an herbal tea 2 to 3 times a day. This plant can interact with other supplements and medications. Therefore, be sure to consult your doctor before using this herbal tea. Consult with your doctor so they can advise you about possible interactions between nettle and your other medications. The fourth plant in this regard is saw palmetto. Saw palmetto is a plant that has traditionally been used for treating enlarged prostate. It has been used in Europe, and in a previous video where we talked about prostate treatment, we also mentioned this plant. This plant has anti-inflammatory properties and also prevents the conversion of testosterone to dihydrotestosterone. As a result, it helps prevent prostate enlargement and the occurrence of urinary retention if your prostate is enlarged be sure to. It is important to consult your doctor so they can determine the underlying cause of this condition. The next medicinal plant is sweet licorice, which is a form of Indian licorice extract. It's a natural alternative to common antibiotics that can be used to treat urinary tract inflammation or bladder inflammation. Using this herbal extract can assist in treating incomplete urination caused by internal inflammation and bacterial infections. For this purpose, you can prepare exactly 50 milligrams of Indian licorice root. You need to thoroughly crush it until it becomes a smooth paste, then slowly boil this paste with a full glass of water for 30 minutes. After that, carefully strain the herbal infusion and drink it 3 times every week.